Good morning.
Good morning.
Did you drink your coffee today?
No, we need you to drink some for us.
Drink some coffee.
Yeah. We refresh now.
How do you feel now? Good?
Good, very good.
Good morning.
Good morning.
Okay. What do you want to study today?
Clinical procedure.
Imaging. Oh, that's nice.
Imaging
Good
and
job.
diagnostic.
Good job. Imaging. Imaging means using different kinds of rays of irradiation, including X-ray, CAT scan, MRI, ultrasound, to visualize inside the body. When you examine the patient, you can examine from outside, and you just by palpation or auscultation, you can just figure out what's going on, but it is limited. By imaging, you see the internal organs in details. Is that good?
Yeah.
Very good.
You want to see everything?
Everything.
Yeah.
Everything. Okay. Starting with X-ray. Everyone having an idea about X-ray. At least you did like X-ray once during your lifetime.
Yeah.
At least chest X-ray to make sure you're not tuberculous.
Mm-hmm.
When you do the PPD test, you did the chest X-ray. Is that true? No?
No, I mean I didn't do it. They only make you do the X-ray if it comes up positive.
Positive. So it came up negative.
Yeah.
So that's why they didn't do X-ray for you.
Yeah.
But next time when you do it, it comes positive, you will do X-ray, chest X-ray.
Okay. Once you have it in your system.
Once you have it, yes. When you have the antibodies in your system,
mm-hmm.
and the next test becomes positive, they have to make sure you're not tuberculous, you're immune, and they will do the X-ray on you.
Okay.
Anyway, do you know what the X-ray machine is formed of? How it looks like?
What it looks like? Yeah.
X-ray machine. The X-ray machine is formed of three parts. Table, tube, and control panel. How many parts the X-ray machine is formed of?
3 parts.
3 parts. 3 parts. The table, tube, and control panel. The table is not a regular table, it is a specific table for the X-ray, and it is able to move in different directions, even upright position or angle position. Can move in any position. Also, it has it's prepared specifically to put the film underneath or...
Good morning. Morning.
No, thank you. Thank you. That's okay. That is the X-ray. That is the table of the X-ray. You want to give to your friend? Thank you. The X-ray tube is a tube like this with an opening here, and the X-ray is come out this way. And goes to the patient and to the X-ray film. So this part here is not covered because this is a site for emission of the X-rays from the tube. Let me give you just an idea about the different kinds of rays. The rays or irradiation, it moves into waves. We have a long wave, we have a short wave, we have a microwave. Long wave, it moves like this. That is the irradiation.
Mm-hmm.
Short wave, it moves like this. Microwave, it moves like this. Which one is longer? The long one.
Yeah.
And this is shorter, and this is shorter.
Shorter.
Very good, the shortest. Very good. Let me ask you a question now. Which one is faster?
The smallest one.
The microwave is faster.
Faster.
When the wave becomes shorter, becomes faster. Which one is stronger?
Yeah, the long wave.
Which one is stronger? The short one, the micro.
Oh, the micro is stronger.
What do you mean stronger? The
There's more
ability,
radiation.
the ability to penetrate the tissues.
Yeah.
So this one is like the sun ray, is not able to penetrate the tissues because it is weak. It's long wave. If it penetrates the tissues, it's for a short distance, it's fine, but it's not able to go deep. This one is stronger a little bit. This one much stronger, more stronger. Okay, microwave, and that is a microwave. You use it in your house to heat up the food because it is strong and it penetrates inside the food and heat it from inside. Let me ask you a question now. When you put some food in the microwave and the cycle is done, click, done, and you open immediately and you put your hand inside, how do you feel?
Hot.
It's hot.
Yeah.
Why? When you wait for a couple seconds and you open the door, you put your hand, it's not hot anymore. Can you explain that to me?
Because the radiation is still circulating.
Very good. Here is the point. When you put the microwave on and the machine is running, this emission, this wave, microwave, is emitted from the microwave to the inside room. Once the cycle is finished, they don't send any microwave anymore. But do you think what's going on inside the room? Still, these waves bouncing between the walls of the inside room, still bouncing. When you put your hand, you feel it. Mm-hmm. Okay, very good. But when you wait a couple seconds until these waves settle down and finish, and you put your hand, it's more safe now. Same thing with the X-ray. With the X-ray. Okay.
So when you have a microwave at home, it's better to let it cool and then put your hand in it.
Sure.
Okay.
Look at this tube here. The waves, the X-ray is emitted through this opening. Is any chance for the X-ray to get through here? It's a strong wave, short wave, and has a power of penetration. Is any chance to get through here? The answer is yes. But we don't need that because this is harmful. We need to control. This is dangerous X-ray. Could be dangerous, could be useful. When you use it in the right way, it's useful. Wrong way, it harm yourself. Very good. So what to do to prevent any X-ray to get through anywhere except this opening? They cover this tube the layer of lead. Lead absorbs the X-ray, and the X-ray is not able to penetrate through the lead. Okay? So in this way, the X-ray, when you start to put the machine on, the X-ray is coming only through one opening. So it's under control. What's the problem with lead? The lead prevents the X-ray to get through. It absorbs the X-ray and stop it. Very good. For the whole room of X-ray, is any chance for the X-ray to get through the wall?
Yes.
To the outside people?
Yes.
Yes. So what they doing?
Cover the room with lead.
They cover the whole room with lead.
Lead.
So it is a special room prepared for X-ray. You cannot put the X-ray machine in any room. It is specially prepared room. Is that clear?
Yeah.
Very good. So anyone outside the room will be safe. But let me tell you, the technician stay inside the room. Some of the X-ray rooms, the technician has to stay inside. Some of the rooms that is prepared for the technician to stay outside. When the technician stay outside, he's safe. But how about if he stays inside the room? Let me tell you, the patient doing X-ray, he's taking certain dose, right? And the next patient taking another dose, and the next patient taking another dose. But who's taking these 3 doses together? The technician is exposed to the X-ray through different techniques, through different X-ray taken, right? Does it harm his body?
Yes.
Yes, can kill him. So how the technician protect himself?
By going outside, or by wearing a special vest, or going behind a special machine.
Either if the, okay, very good. If the room is prepared for the technician to stay outside, there is no problem. But if the technician must stay inside the room, he gotta protect himself. He gonna wear a lead gown, so it protect his body, so it's not exposed to every single dose of X-ray. Okay, so how the technician protected is protected against exposure to overdose of X-ray, but by wearing lead gown. Some of the X-ray rooms are prepared by a wall of lead, wall covered by lead, and the technician stay behind the wall. Also, it's protected. So the idea is, the main point is lead. Lead to protect yourself. That clear?
Yeah.
Is anything hard?
No.
No. Okay. That is the tube and the control panel. What is the control panel? The control panel is a button. When you press the button, the machine starts to emit the X-rays. Okay? This is called control panel. And that is why it depends. If the control panel found outside the room here, you have to go outside the room and prepare the patient and ready. The patient has to be ready to press on the control panel. Sometimes the control panel is inside the room. So what to do? Either you wear the lead gown, or if the control panel behind lead wall, you don't have to wear the gown, because the lead wall protect you. Is that clear?
Yeah.
So that means if you have a lead wall inside the room, you don't have to wear the red gown. But let me tell you, the lead gown is very heavy and you need strong body to carry that. I have a question now. Why do you have to protect yourself against X-ray? Is the X-ray harm you?
Yes.
Okay.
It sounds radiation.
How it harm you? What is the danger of X-ray?
Radiation.
Danger of radiation. The harm effect of X-ray. Number one, it damages the eye. It damages the eye. You're going to turn blind. Overdose. Number two, it damages skin. Damage something else?
The brain or something.
Bone marrow. Damage bone marrow. Did you ever hear or did you ever see any pregnant woman doing X-ray?
I mean, yes and no.
Yes and no?
No.
No only.
No.
No only. The X-ray is damage the fetus.
When I was pregnant, I had to do an X-ray because my.
No, on the teeth is okay.
Okay.
But you cannot do
Do it
X-ray in your
in the
abdomen
hand.
or your chest
Okay.
because it is harmful for the fetal life.
So the dentist one is different from the other one, the dental X-ray.
The dental, this small dose of X-ray and far away from
the
here,
fetus.
so
Okay.
it's okay. And the fifth one, the fifth harm effect of X-ray, which is not so important. You know what?
Reproductive.
It damages the
Reproductive organs.
reproductive organs. Is the reproductive organs important?
Very important.
And that is why some of when the patient need to do chest X-ray, they put like just a gown here to cover the reproductive organs, not to get harmed, not to harm the reproductive organs. Okay, these are the danger of X-ray.
X-ray.
And that is why the technician and everyone, not just the technician, protect himself against overdose of X-ray. That clear?
Yeah.
What is so hard about this?
Nothing.
Nothing? Okay. You have in page 2 here the harm effect of X-ray.
Yeah.
For the technician also, and anyone working on the X-ray, because he's exposed, whatever you protect yourself, you're not immune for exposure. You expose yourself anyway to a small dose of X-ray. If you do X-ray for 10 people or 20 people, 30 people a day, what do you think? You're immune? You protecting yourself, but still your body receives radiation. How to know that and how to measure how much radiation to see if you're still in the safe place. If you receive radiation but you're still in the safe site. Okay? Usually they wearing what's called dosimeter. Dosimeter is small meter. Okay? It counts how much X-ray you exposed to this today. Okay? At the end of the day, you give this dosimeter to your supervisor to check how much X-ray you exposed to. It's called dosimeter. Here is the question. What it protects you in the X-ray room? Lead, right?
Mm-hmm.
Lead gown, lead apron, lead wall.
Yeah.
Dosimeter? Is the dosimeter protect you?
No.
No, it's just a measure how much X-ray you exposed to. It's one of the questions. All the following are protective. For the X-ray technician, and you mentioned the X-ray wall, the lead gown, lead apron, lead wall, and dosimeter. Except what? Except dosimeter, right? Very good. Did you ever look at the X-ray film?
Yeah.
X-ray film. Did you ever see X-ray film?
The film.
No?
When
Film.
I see the film, when they show you like broken bones, like if you put it up, the doctors put it up in the air and they could see it.
Like.
Yeah.
Okay. Okay. How it looks like? It looks like this.
Mm-hmm.
And what is the color here?
Black.
Black. But not just black, right?
Yeah.
It has a gray or white,
Yeah, white.
shadow,
Yeah,
right?
Yeah.
White shadow, like here. This is black. And this is white.
Yeah.
Is that true?
Yeah. So they could see it.
You start to push the control panel to get the shot, X-ray shot. And you adjust, before you do that, you know that you adjust the dose of the X-ray and the distance between the tube and the patient, okay? Usually on the X-ray machine, next to the X-ray machine, there is a chart. If you do X-ray for certain part, for the chest, for example, for the chest, you have to measure, there is measurement, some specific measurement to measure the depth of the chest wall, okay? And then you see, according to this measurement, you look at the chart here, how far the tube should be and the dose. And you follow these instructions. You adjust, the tube is movable. You can move it backward and forwards. And you follow the instruction for the distance and the dose on the tube. Okay. And you give the instruction of the patient to take the shot. Very good. This patient here, you take an X-ray for the femur. And when you, after when you process the film, and you find this picture. Okay, what that means? You give the shot, the dose, right? And the tissue, the body having different kinds of tissues. We're having muscles, bone, blood vessels, skin, fat, cartilage,
Everything.
nerves,
Yeah.
everything. But when you get the shot, you don't see any of this.
Mm-mm.
What do you see here?
The bone.
Just bone? Where are the other tissues? Are we doing X-ray to see the bone?
Yeah.
The X-ray, let me tell you, is the best way for bone diagnose, to diagnose the bone disease and bone fractures, fracture bones. X-ray is the best bet, it shows the bone, just it covers everything that shows the bone. So what do you need? When you see this one here, are you going to be happy?
Yeah.
Yes, good X-ray. Did you ever see an X-ray before you use it? Before they use it. Did you ever see an X-ray before they use it and process it? They process it to put it in the alcohol and water and acid and water and whatever. Process it. Okay. You know what is the color of this paper, X-ray paper, X-ray film, before it's exposed to the X-ray?
White?
It's white. It looks white. When it's exposed to the X-ray, it looks what? Black. That means it's done. Okay? You cannot use it one more time. Very good. So when you see white and dark color here, what that means?
It's done.
This one, this area is exposed to the X-ray, and this area is not exposed. So when you process the film, it shows the final color here. This is exposed, this is not exposed, and it shows what is this. What is in here? Muscles, nerves, fat, skin. And here is the question. Why this disappear and this appear here on the film?
Because they're not looking at that, they're looking at the bone.
How about if you look at the muscles and the muscle disappear, you cannot see it?
No, I mean because they put the shot, they put it at. Right?
Look, at least she's trying. Guys. Okay. I need you just to remember two expressions here. Radio, peak. Radio, lucent. Radiopaque and radiolucent. Look at these two expressions here.
Okay.
Radiopaque means it absorbs the X-ray, it does not allow the X-ray to pass through. So the bone is radiopaque. It absorbs the X-ray comes to here and stop. And the background is not exposed to the X-ray. How about the other structures, the soft tissues, muscles, nerves, fat, skin, other structure? They are what?
Radiolucent.
Radiolucent. The X-ray is able to penetrate and get through and touch the film, and it mark here, this is radiolucent structure, this is radiopaque. Do you know what is the difference between radiolucent and radiopaque?
Yeah, you just showed us it.
Radiopaque,
You can be able
it absorbs the X-ray, and the X-ray is not able to penetrate. Stop it. Stop the X-ray. Radiolucent, no, the X-ray gets through and go to the other side. Let me show you this. If you do an X-ray for the bone and you find the bone like this, but someone came in an accident and to find the X-ray is going like this, what that means?
It's broken.
Broken bone. So it's easy to diagnose, to use the X-ray to diagnose fracture bone? Yes.
Yes.
And also the type of fracture. Like sometimes you find the fracture is not even like this. Also fragmented fracture like this. Several pieces. Fragmented fracture. So you diagnose fracture and the type of fracture also. And the X-ray is excellent procedure to diagnose bone disease and bone fracture. Bone tumor, osteomyelitis, inflammation of the bone, X-ray. Okay? Can you use X-ray to diagnose pregnancy?
No, because it's going to be radiation to the baby.
It killed the baby.
Yeah.
Why, you want to diagnose pregnancy? Oh, congratulations, you have a dead baby now. Okay. Is the X-ray important to diagnose bone diseases? Very good, very good. Can we use, here is a question, listen to this. Are you ready?
Yeah.
Can you use the X-ray to diagnose diseases of soft tissues?
Of soft tissues?
Soft tissues.
I would say no.
Absolutely not.
Yeah.
No, sometimes we use a chest X-ray to diagnose chest disease. And the lung is soft tissues. Sometimes. Just to put certain dose, and you see the soft tissues as a shadow. You see it's not clear enough, but it's as a shadow and it's enough for diagnosis. Like pneumonia, bronchitis, like hydrothorax. You can use this to diagnose. Okay, very good. But it's for limited. Also for the renal stone, kidney. Because the kidney, look at the kidney. Let me use this. If this is the kidney, and the ureter, look at the X-ray. Soft tissues look faint, right? But it's not clear enough. But at least you see the outline and the shadow of the kidney and the ureter by the X-ray. But if you have a stone, you find the stone is clear like this. Because the stone is what?
Right.
Radiopaque.
Oh.
This is radiolucent, that's why it's not clear enough. But this is a radiopaque. You see the stone very clearly.
Okay.
Okay? For renal stone. How about if we need to visualize arteries and vein? Can we use an X-ray?
For the arteries?
Arteries and veins.
No.
Yes.
You could?
Special technique. Using the special technique. Okay? And that is why we have
But the arteries
what's
are
called...
so small. How they, it's so, and the veins.
There is what's called contrast media.
Okay.
Contrast media. What's contrast media? Is that called media or medium? Is that called the contrast media or contrast medium?
Contrast media.
What's the difference between these two words?
Medium is
The contrast medium is a singular form, and the plural form is contrast media. Okay? Very good. barium sulfate, iodine compounds, air, carbon dioxide. What that means, contrast medium or contrast media. These contrast media are radiopaque. Radiopaque.
So you could see.
What that means?
That you could see it. See
That
what's
means
happening.
it stopped the X-ray, and you can see whatever the organ it contains this media. You can see it using X-ray. Barium sulfate is used for the gastrointestinal tract, and that's why we have barium swallow and barium enema. Barium swallow and barium enema. We don't use the barium for any other organ, just for gastrointestinal tract. Just remember, barium, gastrointestinal tract, either by swallow or by enema. How about iodine compounds? Iodine compounds in the form of tablet or injection, intravenous injection, and it's used to see the blood vessels, kidney, and biliary tract. And thyroid. Thyroid function. What is the purpose to use iodine compound? This is it. Blood vessels, to look inside the blood vessel, or the kidney and urinary tract in general.
Mm-hmm.
Not just the kidney, ureter, and bladder. Biliary tract, liver, and thyroid. When I give you a question, I tell you, what is the good contrast medium to study the kidney? What do you say? Iodine compound.
Okay.
What the good medium to study the blood inside blood vessel? Iodine compound. What the good medium to study the gastrointestinal tract? Barium sulfate. You cannot mix it.
Mm-hmm.
Air and carbon dioxide, this is to study inside cavities like joints and inside the fallopian tube. Sometimes they're using air in combination with barium enema to push the enema inside. Again, what are the contrast media? What are the contrast media they use in the X-ray?
Barium sulfate.
Four, right?
Yeah.
Barium sulfate, iodine compound, air and carbon dioxide. before you do the X-ray to the patient, do you have to prepare the patient?
Yes.
In every X-ray, you have to prepare the patient?
Yeah.
Actually, yes. Very good. Yes. Because different kind of X-ray or different procedures, X-ray, taking X-ray to different organs, it needs different preparations. Okay. In general, who is responsible to prepare the patient, give him instruction to prepare himself or herself to the X-ray? Who is responsible?
The technician.
The technician or the medical assistant. It's your job.
Mm-hmm.
But just always remember that when you talk to the person always apprehensive against X-ray. He doesn't know what's going on. He's a patient.
Yeah.
Okay? Very good. And you're a medical assistant, don't worry, baby, it's okay, everything is fine, it's non-invasive procedure, doesn't harm you, and it's your job. And you start to give him the instructions. And when you give instruction to the patient, and the patient is apprehensive, he will forget. When she go home, she will forget. Especially when she leave the office and go with her boyfriend. She will forget about you and the X-ray. And then it's not enough, and I instruct the patient to do the right technique, the right preparations, and the patient says, no, I don't remember. So what's the problem? The problem is when you give her verbal instruction, you have to give her what? A written instruction to sit at home and start to read it step by step. The preparation could be light meal the day before. Usually the patient prepares herself or himself the day before the X-ray. Either NPO. What's NPO? Nothing by mouth. Nothing by mouth after dinner. And some of the procedures you need to take laxative the day before, laxative, and the enema in the morning to clean the gastrointestinal tract. When you take the laxative at the night time, in the morning time you find diarrhea. Mm-hmm. And you do enema, so the gastrointestinal tract is clean, ready for the X-ray. Okay? Because when you do the X-ray, you don't want to see the food inside, right? Mm-hmm. You want to see the lesion. So it has to be clean. Very good. Also, some of the procedures you need to not to drink milk in the morning. In the morning, the day before, you don't have to drink milk because it makes reaction with the procedure. Not actually, it's not with the X-ray, with the other procedure. But just I'm telling you, different procedure need different techniques. You have to tell the patient what to do and to give him written instruction. Okay? Very good. Are you familiar to the name of the different X-ray? Different name of X-ray? If we say barium swallow, barium
swallow is barium sulfate, contrast.
And barium enema.
It's also barium sulfate.
This is different procedures. You're using contrast media. This is here from the name. You're using the barium, right?
Yeah.
And geography. Colon geography. Cholecystography, cystography, intravenous pyelography, IVP, ascending pyelography, or retrograde, ascending or retrograde pyelography, ascending or retrograde pyelography, hysterosalpingography, hysterosalpingography, and mammography. These are the different types of X-ray we're using the contrast media. We're going to study each one, study just in general each one of these. This is the 10 procedures. It's done by using the contrast medium. You need a break now?
You need a break?
Yeah.
Okay, so we take a break. You need a break? Okay, so we take a break.
10 minutes?
Yeah.
10 minutes break. Now, are you ready?
Mm-hmm.
These are the 10 procedures here. You do it for using the radiopaque substance. Okay? Let's start with barium swallow, barium enema, angiography, cholangiography, cholecystography, cystography, IVP or intravenous pyelography. Intravenous pyelography. Retrograde pyelography. Hysterosalpingography and mammography. Well, actually, we don't use it in mammography, but this is one of the procedures. We don't use any contrast medium. Anyway, you know what that means, barium swallow, barium enema? Let's start with barium swallow. From the name, barium means you're using barium sulfate. Swallow means you take it by mouth. Very good. So this is a contrast medium. It's a choky substance like milk. Looks like milk, but it's more heavy. And usually with a different flavor. And you swallow this contrast medium, barium sulfate, and then they start to take different shots on the gastrointestinal tract. Well, actually, barium swallow is used to visualize the upper gastrointestinal series. What do you mean upper gastrointestinal series? The upper gastrointestinal tract is formed of the stomach, the esophagus, stomach, and duodenum, jejunum, ileum. All of them are called the small intestine, and then the large intestine started, right? After the small intestine, after the ileum, here, the large intestine. That is the whole gastrointestinal tract, starting from the esophagus, stomach, and the small intestine, all of it. We call it upper gastrointestinal tract. Upper gastrointestinal tract. Started from the colon, here, the large intestine, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, anal canal, all this, lower gastrointestinal tract. So if you want to do X-ray to visualize any part in the upper gastrointestinal tract, what is the easiest way to use it? The barium swab. Gastrointestinal tract, we have upper gastrointestinal tract and lower gastrointestinal tract. The upper gastrointestinal tract started from the esophagus, actually from the pharynx or from the mouth. You can say whatever you want. But here, let's say, start with the esophagus, stomach, and all the small intestine, duodenum, jejunum, and ileum, all together. They are called upper gastrointestinal series. So when you drink the barium sulfate, and they taken several shots, X-ray shots, just can imagine the barium sulfate moves from here to here, and then to here, and to here, right? Very good. So when taken several shots after 5 minutes, after 10 minutes, after 15 minutes, different shots, they can visualize the whole upper gastrointestinal series. Usually they turn the patient from side to side to see the different, the organ from different angle. Okay, very good. But now we have what's called fluoroscopy. Fluoroscopy with the using a fluoroscope. What is the fluoroscope? Well, actually the patient, when the patient is prepared, you know how to prepare the patient. The patient has to take like light meal the day before, okay? And then in the afternoon they have to take laxative. And then in the morning, after dinner, NPO, nothing by mouth. Unless if you want to drink water is okay, but nothing by mouth. Until the morning time when you do the enema to clear to clean the gastrointestinal tract, and you start to do the procedure. Okay? This is a preparation. Very good. The fluoroscopy is when you're already prepared, you stay in front of the screen, and the X-ray machine emits its irradiation, and you start to drink the barium sulfate, and the technician is sitting behind the machine and in front of the screen, and he's looking at what? Looking at the movement of the barium sulfate when it goes down, and he sees what? The movement of the gastrointestinal tract.
Okay.
Do you remember the name of the movement? Peristaltic movement. The peristaltic movement of the gastrointestinal tract, of the esophagus, the stomach, and the small intestine, and this way they can recognize any lesion or tumor or disease in the gastrointestinal tract.
Okay.
Is that clear?
What you said it was peristaltic?
Peristaltic movement. All the gastrointestinal tract using the peristaltic movement to move the food from the mouth, from the esophagus till the end of the gastrointestinal tract. They're using peristaltic movement. How about if we need to visualize inside the large intestine, the colon, including the ascending colon? This is called the cecum. The beginning of the ascending colon is called the cecum. And what is this? The appendix. Appendix.
Okay.
See when you have appendicitis?
Yeah.
You hold this area, because here, appendix. Cecum. And then ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anal canal. All this, the lower gastrointestinal tract, we cannot use barium swallow because it takes long time, right? So the best way is to do what? Barium enema. Barium enema. Also in this barium enema, you have to prepare the patient carefully because you need to clean even the lower gastrointestinal part here. You have to clean everything. Same thing, non-dairy food the day before. You can eat jelly, tea, coffee without milk. And you have to drink water every hour, 8 ounces water every hour. Okay? And then in the afternoon, you take Dulcolax tablet. It's laxative. Or magnesium sulfate, also laxative. Until light meal in the dinner. Light dinner. No dairy food. Because dairy food needs more time for digestion. So all this simple food, after midnight, after dinner, nothing per mouth. And then in the morning time, you do enema. All this before, this is the preparation. And then, whether barium swallow or barium enema, either way, after the procedure, when you finish the X-ray, they ask you to drink a lot of water. Why? To flush out the remaining of barium sulfate. Nothing stay inside your body. You flush it away. Okay? Very good. Especially in barium enema here, when you do barium enema and you instruct the patient, if you do any barium enema, in the next 24 hours, if you don't go to bathroom, you have to call the doctor. Some patients, they having what's called paralytic ileus. The intestines stop working, and they're gonna die. So they have to do, it's emergency. They have to take some medicine to restore the action, the contraction of the intestine again. If it doesn't respond, they do surgery. It's fatal. Very good. What is the enema here? The enema, instead of pushing the barium sulfate from here, they put this barium sulfate through the rectum. They put the scope here and they push the barium sulfate until here, and they add air also to push the barium sulfate, and they fill all this sigmoid colon, the colons, all the large intestine with barium sulfate, and they start to take the X-ray. In this way, without barium sulfate, you do X-ray for the colon, you don't see anything, right? But with the barium sulfate, you see the colon clear here. Clear. Why? Because the barium sulfate is radio opaque.
So you could see, yeah.
Radio opaque. Stop the X-ray and you can see the background of the X-ray film. That is the barium sulfate, swallow and enema. Any question?
No.
No question?
No, it's actually interesting.
Very good, very good. Angiography. The next procedure is angiography. What is angiography? Angio means tube.
Tube. Angiography.
Angiography to visualize inside the blood vessel. Angiography means what?
To visualize inside the blood vessel.
Are you sleeping or something?
No. Oh, I just said it.
You need some coffee?
Yeah.
Okay. So angiography to visualize inside blood vessel. Very good. What do you think, what kind of radiopaque substance here we can use? Iodine compound. Can you use barium sulfate? No, the patient will die immediately because you're going to block the circulation. Barium sulfate is a thick fluid. Okay? So, but the iodine is watery. So, using iodine compound. There is two ways here for angiography. You need to see the pulmonary circulation, or the pulmonary artery, or the coronary artery, or any artery, aorta, any artery. Okay, you inject the iodine compound intravenous, and you take the shot on the artery that you located. Okay, very good. When the artery is full of the iodine compound, it becomes radiopaque, and you will be able to see it. So what do you want to see the artery for? What do you want to look? What are you looking for?
To see the arteries of any.
For any occlusion, block, or narrowing artery, like coronary arteries, angina pectoris. Very good. Also pulmonary embolism, if you have pulmonary problem in the pulmonary artery. Very good. Either way, if you inject intravenous, or sometimes they put the cannula and push the cannula toward the artery and inject the iodine local at this area, and they take the shot. Okay? And
even when they doing the procedure that they put you through the machine, I forget what is the machine, the MRI, is it MRI? And it is also the intravenous, right?
MRI, yes.
Do they use this?
Iodine, yes.
Yes, they use the iodine.
Yes.
Because it gets hot or something like that, right?
Yes, yes. Very good. Very good. That is the angiography. Is the angiography why are you using the angiography for? To diagnose any blood vessel disease, including aneurysm. Do you know what aneurysm means?
Yeah.
What's aneurysm means?
Like a clot in your brain, or
Clot?
not clots, like how to put it, a blood.
This is the artery here. A lot of people, I heard, they having what's called the aortic aneurysm. What's aortic aneurysm means? The artery is running like this, nice and even like this. For some reason, sometimes you have weakness in the wall of the artery. This area is weak, and under pressure, what happened? It's inflated. It's ballooned like this. Hey, how you doing, sir?
He's done.
You done? Your girlfriend is here. You waiting for your girlfriend?
No.
No, he's not a good guy. He's not waiting for
What you
you.
say, sir?
Come. Go to the movie here.
Say hi.
Say hi to the...
Yeah, Mary and Patricia. Kinel is here, no?
I know, I just saw him.
Yeah, Kinel. Patricia is here. She
Yeah, no, he's a bad guy. He doesn't want to see his girlfriend.
Dr. You say class is done?
No, I'm not. 10-minute break.
Oh, you tell me.
I release my students, usually our class ends at 1:10. I release them early. 12:59. Yeah, why not? Yeah. 9 to 1:10.
You're a generous guy,
Yeah.
generous,
I
yeah.
told them I will release you early because I allow my student, instead of 1:10, 12:59.5 seconds. Yeah.
I hate you. He's the best teacher in the school.
Well, but you, he's also the best. But you, he doing coding and billing. And they coding and billing.
Okay.
They teach us good.
Are you ready?
Yeah.
All this come out in here. I'm gonna erase all this. So, under pressure, if any weakness in the arterial wall and the arterial wall having high pressure and it becomes inflated or ballooned like this is called aneurysm. If it rupture any time, it's a big artery and it rupture like aorta and it rupture any time, don't call 911, don't call the ambulance.
Call the cemetery.
Changing address.
So it's not a, like when people have aneurysm in the brain, right? It's not like a blood vessel, that a blood clot or something. It's not
No
like
blood clot. Aneurysm means,
inflation.
yes, means weak area in the artery, and it is, if it rupture any time, and this is, I'm not sure if this is gonna lead to death, but it at least gonna lead to brain hemorrhage and could lead to death, or if they treat it fast, go to the hospital fast and they stop it fast, it could leave paralyzed.
Okay.
Losing memory,
So just like
having
that.
some problem.
So what is the liquid inside? If you just inflation, it's just the artery walls opening up.
Yes.
Okay.
This is called aneurysm. To
Okay.
diagnose the aneurysm, also they're using iodine compound injection, or by catheterization, they introduce the catheter inside and inject the iodine compound in a local area, and they do x-ray here. Is that clear?
Yeah.
Back to the question. Can we use the x-ray to visualize soft tissues? Yes, by using what? Contrast medium.
Yeah.
One of the contrast medium. Everyone knows what angiography means?
Yeah.
Okay.
Visualize that the
Very
inside of
good,
the blood.
very good, very good. Excellent, excellent. Extra credit. Cholangiography. Same. Remember angiography?
Yeah.
And this is called angiography. Angio again here, angiography. Okay? But it is a prefix, having a prefix called chole. What's chole means? Chole means liver.
Okay. Yeah.
So what that means?
Graphic.
The tubes coming out from the liver. Look at the liver here. Hepatic duct, cystic duct, gallbladder, and then common bile duct. Cholangiography, to visualize all this stuff here. To make it easy for you, cholangiography and cholecystography, there is no big difference. Just the difference, I'll tell you what is the difference is. Cholangiography, to visualize all this. Cholecystography, cyst means what? Cyst means a cavity. Cavity. This is a cyst. So cholecystography is, chole means liver.
Right.
Cholecystography means to visualize gallbladder,
Okay.
specific for the gallbladder. Same preparation for the patient. And then you take the iodine compound and they take x-ray to visualize all the structure. But in case of cholecystography, after you take in the shot, you instruct the patient before, the day before, don't eat any fatty food. Any fatty food. No fatty food. Okay? After the procedure, when you take the first shot, you know what happened? In cholecystography, they give the patient food containing 100 grams of fat. And they take another shot. Why do they do that? Why they do that?
Why they give the
fat and they take another shot? Because the fat stimulate evacuation of the gallbladder. When you eat fat, you stimulate the production of the bile here. So when you come in to take the x-ray without eating fat even one day before, and they see the function of the gallbladder, and they, after the fat, when they give you the fat, they take another shot and they see what is the gallbladder evacuate the bile. So they checking the function of the gallbladder. Also, during this function, they checking the patency of the tubes. They checking if any stone inside here, gallstone or cholelithiasis. Any inflammation of the gallbladder, cholecystitis, inflammation of the gallbladder, cholangitis, inflammation of the tubes here. Okay, very good. So this is cholangiography and cholecystography. I'm not going to erase this now. Let me erase this part here. I need you to compare these two procedures. Chole means what? Liver.
liver.
Cysto means
Cyst.
cavity or cyst, right? Graphy to visualize. Very good. Oh my gosh, another cysto here. What is the difference between these two words?
What's cysto mean?
Cavity
Cavity.
means cyst. Cavity.
Cyst.
Pouch. Balloon. Another cysto here, cystography. Do we have another balloon inside your body?
Your bladder.
Bladder. Don't mix it. Cholecystography means this one. But cystography without chole means what? Urinary bladder. Urinary bladder. So cystography means to visualize the urinary bladder. Again, what kind of contrast medium? What kind of contrast media are you using? Iodine compound. Iodine compound. To visualize the bladder here, to visualize the bladder, we have two ways. Two ways. I'm going to give you the first way now, but the second way, I leave it until we talk about the IVP here. Okay? The first way is to inject the contrast medium, the iodine compound, intravenous, and to visualize when it circulates with the blood and reaches to the urinary bladder, you take X-ray to the urinary bladder. Is that clear?
Yeah.
But the other way is, I'll tell you the other way. The other way, you can push through the urethra the contrast medium inside the bladder, and you take the shot also. This is a two ways. Okay? Either intravenous or through the urethra. It's called cystography. Why you do that for the bladder? What do you want to see in the bladder? Any inflammation or tumor. If you see any inflammation or tumor. Any question on the cystography and cholecystography?
No.
No. IVP or intravenous pyelography to visualize KUB.
Kidney and bladder. Kidney, urine, uterus and bladder.
Kidney,
Uterus and bladder.
kidney what?
Uteria and bladder. Urethra.
Ureter.
Yeah.
To visualize kidney, ureter and bladder. Very good. This is also can be done by two ways. These two ways for KUB to visualize kidney, ureter and bladder. Intravenous pyelography, usually we say pyelo for the kidney. Okay? Pyelography to visualize the kidney. It could be intravenous pyelography. You inject the iodine inside the vein and wait until it goes to the urinary tract, and you start to take X-ray to the whole urinary system, kidney, ureter, and bladder, and to diagnose any disease or tumor or stone. Okay, very good. Same thing, it could be intravenous or could be retrograde. Retrograde means opposite side. Same thing. This is a kidney, ureters, bladder, urethra. You push the dye from here and push the dye to here and to here. Fill all this with the iodine compound and you take the X-ray. This is called retrograde or ascending pyelography. Retrograde means in a wrong way, opposite way. Okay? So it could be intravenous or retrograde to visualize KOB, kidney, ureter, and bladder.
Okay.
We have a problem with the iodine compound. Some people are allergic to iodine. And that is the responsibility of medical assistant to check if the patient is allergic to iodine compound. Can you imagine if someone is allergic to iodine compound and is taking intravenous iodine?
Yeah.
What's going to happen? At least anaphylactic shock.
Yeah.
At least. If he's not going to die. Whose fault is this?
Our fault.
We don't want to be in a big trouble like this. We're going to need to go to work safe and come back home safe. Right? Very good. How to check if the patient is allergic to iodine? If the patient, you ask the patient, are you allergic to iodine? And the patient tells you, what the hell is iodine? I know what iodine is. Okay? So, but there is one question you ask to the patient and you pick it up if he's allergic to iodine. What kind of question? You ask the patient, are you allergic to fish and seafood? Fish and seafood is rich in iodine. And that is why those patients having hypofunction of hypothyroidism, they always recommend to eat fish to supply iodine to the. Very good. If the patient says, no, I'm not allergic to fish, I love fish. So he's not allergic to iodine and he's ready for the injection, right?
Yeah.
About if the patient says, no, I'm allergic to iodine, to fish.
To fish.
I'm allergic to fish.
Iodine.
That means he's allergic to iodine.
Okay.
You have to notice right away to inform your supervisor, allergic to iodine.
Okay.
So what they're going to do, they will change the procedure. They don't have to give him iodine, they have to go to another procedure, don't need iodine. That clear?
Yeah.
Very good. The last two procedures here. Hysterosalpingography. Hystero means uterus.
Uterus.
Salpingo means fallopian tubes. Graphy means to visualize.
Visualize.
You need to visualize uterus and fallopian tube. For what reason? For many reasons.
For blockage and lesion.
Inflammation, inability to have kids, to get pregnant. Okay. Here. They push the contrast medium here through the tubes and to the uterus. Usually they using air or carbon dioxide, contrast medium. And they take the X-ray. And this is called the hysterosalpingography. Okay? See any obstruction of the tube or inflammation of the tube, tubal inflammation or block of the tube. The last procedure is mammography, and the preparation for mammography is easy because there is no specific preparation except you inform the patient not to wear any cologne or any powder or any compound containing alcohol.
Okay.
Because the breast will be exposed to X-ray. In presence of alcohol compounds, they burn the skin. They cause burning of the skin. In this case, they taken 2 shots, 2 films. Did you ever see the mammogram machine?
Mm-hmm.
It's a tube like this for the X-ray to get through here, and there is a stand here. You put the breast here, and they take in top view. And they change the machine and take in side view. They press the breast between the tube and the film, and they take in the shot. Also from side view, they take in side view for the breast. Why they do that? Why they looking for? They're looking for any lump or tumor. It will appear on the X-ray, and this is called mammography. It doesn't need any special preparation except not wearing any alcoholic stuff.
Okay.
Is that clear?
Yeah.
What is so hard here? These are the 10 procedures. You're using the X-ray to visualize soft tissues. Any question?
No.
No questions? You want to go home?
Yeah.
No? You want to go home?
Yeah. You don't want to go?
No?
Yeah.
They don't want to go home. You want to go home?
Yes.
No?
Yes.
Okay, so we'll continue next week. Thank you very much.
Thank you.
And don't forget 1 to 3 questions. Okay? It's better to do it in a piece of paper.
Let's see 1 to 3 questions in the back.
No, 1 to 3 in a separate paper, and write your name and the date on your paper.
Okay. Or just questions asking what we're going to do for midterms.
And then collect these papers, and we'll look what kind of questions.
Okay.
Okay? And when I choose any of these questions to the test, you got extra credit, extra. When you do the questions, you got credit already. You will get extra credit. But when I pick one of your questions, you get extra credit. Okay? Thank you. Have a good day.
Okay, thank you.
Is that hard?
No, it does actually.
This is the easiest course.
You